An international study has given new hope of an effective drug to treat Alzheimer's disease.
To this new drug that's being hailed as a turning point in the fight against Alzheimer's. The drug can slow down cognitive decline by up to 35%.
We're seeing the cumulative benefits of years of work coming to fruition.
Even though it would seem a progress that was made, it is the illusion of progress, unfortunately.
About 400,000 Australians are living with dementia, and most of them have Alzheimer's disease. No one knows the cause, but when you look at the brain of someone with Alzheimer's, it's filled with a substance called beta amyloid. So much so that researchers around the world have focused on finding ways of removing amyloid in the hope of relieving the symptoms of Alzheimer's. Early trials showed that removing amyloid didn't work when people had significant dementia. So in recent years, the treatment trials have moved earlier and earlier in the Alzheimer's process before too much brain damage has occurred.
I've got a level of amyloid that's just a little bit higher than average for my age, as I understand it.
Recently retired, Colin Gare doesn't just fill his days playing guitar. Although the amyloid hasn't affected his thinking and memory, Colin is in a separate clinical trial to remove it in the hope it'll make a difference to him in the long term.
And I suppose Alzheimer's scares all of us. It's not a very nice prognosis. I feel quite privileged that I'm involved in a drug trial that may help us better understand the connection between amyloid and Alzheimer's.
Associate Professor Paul Yates is a geriatrician who conducts clinical trials in Alzheimer's disease, including the trial that Colin is on.
The drugs that we're seeing positive results for are what's called monoclonal antibodies. They're targeted against the abnormal proteins that we see in the brain in Alzheimer's disease, particularly one called beta amyloid. So the current trial that's been of most interest is this trial called Trailblazer, and it's been of a medication called Donanemab.
The Donanemab trial that made global headlines tested the drug on people with amyloid in their brains and early stages of cognitive decline.
First, they confirmed that this medication lowered amyloid very powerfully. So 70% to 80% of people in the study had completely cleared their brains of amyloid. They also showed that with lowering of amyloid, people showed a reduction in rate of cognitive decline in the order of about 30–35%.
Not everyone is convinced. An international group of specialists and researchers are concerned that the benefits of these drugs don't necessarily merit the risks or the price tag. One of this group is Professor Alberto Espe, who researches degenerative diseases of the brain. Professor Espe, what do you make of this 35% difference in progression of disease?
The percentages of relative change, they sound amazing, if only that was true, because when we hear 25% or 30%, even 20% improvement in a disease of any kind, you think that's very large. But what's actually much more important is actually knowing where people were at the beginning of the trial and where they end. That's actually more meaningful.
These statistics can do your head in, so let me explain. It's about expressing the statistics in terms of you and me as individuals and what changes we could expect if we were to take the drug ourselves. Imagine that Emily and I are walking towards Alzheimer's disease. Emily's on the drug, I'm not. So I'm walking 35% faster towards Alzheimer's disease than Emily. But because we're walking slowly, when we get to the finish line, the gap between us isn't large. And that's what happened in the Donanemab trial. The 35% slowing in cognitive decline actually translated to quite small differences for individuals taking the active drug. In fact, it was between 4 and 7 months slowing of progression. And some specialists are concerned about the reported side effects. Of the 853 people on the drug, 52 had symptoms from brain swelling, and there were treatment-related deaths.
Of those who were symptomatic, there were some serious complications, including seizures, confusion, and there were 3 people that died within the study as a result of these side effects.
That's incredibly troublesome because in trials, we tend to pick the best, the absolute best individuals to ensure that they are the most robust of any people, that they can actually continue on a very regimented protocol. And so having 3 deaths within this group is a very troublesome component to it. Now, that is likely to be a higher number if we were to deploy this in a much widespread group.
But if it does get approved for the real world, then we need to make sure that the processes in the real world limit people from being exposed to unnecessary harm.
So what's going on here? If beta amyloid is really the cause of Alzheimer's disease, and these drugs are amazingly successful at removing amyloid, which they are, why aren't the results of the drug trials more impressive?
The idea that amyloid plaques, which happen to be identifiable in the brains of people, cause Alzheimer's, was a very interesting, logical, compelling idea. But we have tons of evidence to support the concept that it is a consequence to many different kinds of biological, toxic, and infectious problems that lead to that clinical syndrome we call Alzheimer's. It is not the beginning of the problem, it's the end of many.
Dementia is a multifaceted problem. And if you look at people's brains, particularly with later onset dementia, there's usually a number of pathologies which could be playing a part. So yes, amyloid lowering is an important step, but it shouldn't be at the expense of looking at other options. If you ask people that clinically meaningful benefit of opportunity to spend more time independently, living more active, engaged lives, then for them it's worth it.
Pop it on the floor here, Evie. That'd be right.
A pink car.
Pink.
For Colin,
And the pink car.
these disagreements between scientists are actually reassuring.
And so I actually think it's healthy to have the argy-bargy going on, have the debates, but I also think it's important to maintain a number of different lines of inquiry.